Good Monday morning, everyone. It is November 8th. Welcome into the Morning Medical Update. We are here live inside the Dolph C. Simons Jr. Family Broadcast Studio. And a very special welcome to our benefactor this morning, Mr. Simons, who is joining us this morning here in our studio. He is back there. Hi, Mr. Simons. He is back there in our control room with the guys. So a special welcome to you. And certainly a special thank you. Coming up today, it was a joint effort. We saw how districts came together to help schools reduce the chance of them becoming a super spreader environment. We're going to talk with Dr. Gary Morsch and how he helped advise schools, also how the COVID Care Force and Heart to Heart International are helping to serve our communities and way beyond. So we are joined by Heart to Heart Chief Medical Officer, Dr. Beringer. Welcome to both of you today. Start sending in your questions, please, via YouTube and Facebook, also on Twitter, and to the Medical News Network. There are links right there on your screen, so get those questions in. But first, Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, joins us here on this Monday. Good morning to you.
Hi.
Hi. How did we do over the weekend?
You know, we're holding steady. We did have one death overnight. But overall, our active infections are 14, with 4 in the ICU. And one of those ICU patients on the ventilator. We still have 18 in that recovery period, so 32 total patients. But again, we are seeing some deaths, from day to day as well, which is unfortunate.
Thanks for that update today. Let's get to any reporter questions on the line. Good morning to you all.
All right.
Okay, so let's get your questions sent in. We're going to get to our community questions here in just a moment. But another school year started, as we know, with kids and teachers in face masks. School continued to take extra precautions to keep kids and staff safe. And to make all this possible, though, it took a lot of collaborating and advising from experts across the area. So we're going to turn to our guest today, Dr. Gary Morsch, founder of the COVID Care Force. We're going to talk more about that, but also he is the medical advisor for many school districts here in the metro area and in the state of Kansas. Also joining us is Augustina Beringer, Chief Medical Officer with Heart to Heart International. Good morning to both of you.
Good morning.
Did you have a good weekend?
Yes, absolutely. How about yourself?
Very good.
Great.
Thank you. We were just talking about our Chiefs win.
Absolutely.
Right.
And our Tom Brady fan sitting right here. That's okay. It's okay. Hey, I came from Las Vegas, so I'm
a recent transplant.
That's
so.
okay. I know people often ask me if I'm a Raiders fan, and I have to tell them, of course not. So I totally get it. It's so nice to have both of you sitting here with us today.
Thank you for having us.
So, Dr. Beringer, just tell us a little bit for folks who may not know. What does Heart to Heart International do? What kind of patients and people do they serve?
So Heart to Heart International was actually also founded by Dr. Morsch in 1992 as a way to provide medical support to organizations internationally primarily. We focus on medically under-resourced communities globally, and we support them by shipping medications and medical supplies, hygiene kits, etc. We also provide direct patient care primarily in the aftermath of disasters, natural disasters. So we've been focusing on the Kansas City area now with COVID, because certainly that qualifies as a disaster, right? So we've been working locally, which has been very rewarding as well.
So also founder of Heart to Heart, Dr. Morsch, is what can you add to that as well?
Well, Heart to Heart is a fabulous organization, as Dr. Beringer said, started in 1992 by some volunteers, just who knew that Heart to Heart would become this world-class premier disaster response organization that's doing so much, not only around the world in 130 countries, but also right here in the United States and right in Kansas City.
Such great work they are all doing, all of those volunteers as well. Tell us about COVID Care Force for folks who don't know also.
Sure. Well, COVID Care Force was started in 2020, just last year, so we're a young organization, and there was a desire to really mobilize as many individual doctors and nurses as possible to go to the front lines of COVID. Heart to Heart was certainly involved in that and sending teams, working with other organizations, but I felt like we just needed to hit it hard with one single focus, so started this organization, COVID Care Force. And since that time, we're well over 100 medical teams. We've served Native American communities throughout the United States, and then worked with various homeless shelters, soup kitchens, hospices, clinics in throughout Mexico. People say, well, why Mexico? Well, Mexico we could get to as a foreign country pretty easily. We were allowed to cross the border. Even when it was closed, medical professionals were allowed. And then we would get to Tijuana and then fly to Mexico City or Chiapas or wherever it was that we were working. So we continue to do this. Of course, as COVID starts to go away, hopefully and thankfully, we'll turn our focus to continue to serve under-resourced areas with volunteers. So.
Always a need. And you mentioned volunteers. We're going to tell you how folks can do that here in a bit. And we're going to talk about both organizations throughout this program today. But the big news, of course, was kids being able to get vaccinated, 5 to 11, another group being able to get safe and stay safe. So, Dr. Morsch, I want to start with you. Just over the past 18 months or so, you've been advising school districts around the area. And I want to talk about some of those challenges that they have faced. How have you advised them? How have you worked through making this safe for kids and getting us to this point?
Right. Well, the first thing I want to say is God bless our teachers, our public education and private school districts, staff, administrators, and school board members. I mean, this has been a really, really tough year and a half for them. And so they have gone through things that no one could have ever planned. I don't think anybody going into teaching ever thought that they would, as a school teacher, and I have a daughter that's a school teacher, a middle school teacher, that they would face so many challenges. So I just want to say thanks to everybody that's been involved in trying to make this work. So number one, of course, the commitment of our schools, whether it's teachers or administrators and parents, we want our kids educated. We want to maintain excellence in education. And so that still remains. But in 2020, of course, we had to do remote learning and virtual, online. And I think a lot of parents would agree, and teachers would agree, that was really tough. It was very, very tough to maintain the educational process. Of course, in 2021, when the vaccines were available, that changed everything. And now, with the new opportunity for children 5 to 11 to be vaccinated, that's going to be another game changer. But unfortunately, schools, teachers, administrators, parents, and school boards have had to deal with this kind of political battle of the masking and vaccinations. And different school districts have handled things differently. Some school districts, particularly in western Kansas, dropped the mask mandate, even before the end of the 2020, the fall 2020 semester, even the mandate was gone. So different school districts have handled it differently. Of course, the county health departments are really in charge, but school boards do not have to follow that if they choose not to. So it's been tough for school boards, administrators, and teachers to work together, and there's been a lot of divisiveness through that. So it's been a tough time. But
tough and divisive, but it's been working.
Yes.
I mean, parents have been really impressed. I know I am as a parent, just how well schools have stepped up to say, hey, we're going to just do this right. Have you noticed that too?
It's completely impressive. It's hard enough for us in the medical world to keep up with all the guidelines and make rules for our medical organizations. And here we have lay people with no medical education or background, and they are, just rolling with the punches,
you mentioned
essentially.
Teachers. I mean, teachers stepping up.
They are incredible.
And let's not forget about our school nurses, because this has been incredibly tough on. They've had to lead the way within their own schools and talking to the school board and doing their own advising.
Right, exactly. Yes, well, school nurses, school nursing, again, is different in different school districts. In the Kansas City metro area, most of our school districts have a nurse in every school. But there are many school districts where there's one nurse, perhaps for the whole rural health school district, and they have to travel from school to school. So it's been really tough. School nursing has been getting harder and harder over the years. More data to collect, more reporting to do. The health departments want to know, how much flu is out there and various things. And so with COVID, it really just put that much more pressure on the school nurses. And they have to, they're the go-between between the school and the school board's policy, and then the parents who may or may not agree with that policy. So you've got a school nurse who represents the policy of the school board, of the school district, and yet you've got parents that may disagree. So school nurses have kind of been in had to walk a tightrope in a sense. We have had school nurses quit or resign or retire because of us. And of course, that's happened with teachers as well. Many teachers have left education because of it's just so much that they have to manage. Again, it was hard enough teaching students before COVID, before the pandemic, and now we have this pandemic with all the other issues combined on top of it. So it's been very, very difficult for school nurses.
Yeah, but they've stepped up to that
They've-
challenge
they've-
the best
yes.
they can.
Yes.
Dr. Beringer, let's talk about the under-resourced communities. How is Heart to Heart International reaching them, having conversations with them?
So initially, Heart to Heart International was mostly focused, as I said, in the direct patient care area only after natural disasters. So yes, we did respond to some tornadoes in Kansas and Missouri, but primarily it was hurricanes, Gulf Coast, and then internationally to other parts of the world. When COVID hit, we couldn't travel anymore. And so we were excited to use that opportunity to start serving our very own community in the Kansas City metro area. We started doing that by setting up a free clinic, not specific to COVID, but including COVID services for people experiencing homelessness, and we did that at the Hope Faith Homeless Assistance Campus. And through partnerships, starting with them and then connecting with other organizations in this area that serve under-resourced communities, we were able to expand those services. We did not set up other clinics, but we focused a lot on COVID testing, which was difficult to come by in the beginning of the pandemic. And then now we've moved to providing vaccines. We're doing 5 to 6 vaccine clinics a week, and just mostly in the greater Kansas City area. We've been partnering with organizations such as Juntos and El Centro, and then different local health departments and so forth, just to be able to reach people who otherwise might not have access. Our mission is extending access to healthcare, and this is how we do it.
Thank you for that. How's the turnout been for these clinics?
It's been pretty good. It had waned a little bit, and then when the boosters started to be recommended, we started to see an uptick, and now we are having a lot of demand for those pediatric doses. We are not quite ready for that because there's a lot of pediatric resuscitation equipment, not that we ever needed it, but we want to be prepared. We want to do things safely. Of course, the needles, the syringes, everything is different, and we're in the process of getting set up to do things safely, but we should be up and rolling with the pediatric doses very shortly.
Well, that brings me to my next question. You say doing things safely, which makes me think of trust in healthcare. How does Heart to Heart help build trust? That must have been, always has been a challenge, but then you bring COVID and a pandemic and it's all politicized. You have so many other elements, but how do you tackle that issue?
It has been a challenge. It's been unfortunate that science has turned political. Science is not political. Nobody goes into medicine to hurt people. We just want to help people. But again, by partnering with local organizations who already have the trust of their community, it has given us a good way to reach people that may not know who Heart to Heart is or what we do. I am Latina myself, and so being able to speak Spanish and communicate with certain communities who are Spanish speaking, that has been helpful as well. And we've been really focused on doing a lot of vaccine education as well, videos and outreach, just because, there's a lot of fear. So between access and education, we're hoping that we can reach everybody who can get vaccinated.
Dr. Morsch, jump in on that. Just trust when it comes to the vaccine and medical care in this community.
Well, school boards and schools and teachers and staff deal with the trust issues. There's a huge number of people out there that just, we all know it. Dr. Hawkinson and Dr. Stites and the staff here at KU Med face this all the time. People just don't believe in vaccines. There are a percentage of Americans don't believe in the vaccines or are fearful of them. So one thing I've learned is it's really difficult to communicate facts, because people sitting on the school board or working with school boards, I've testified, I've been in school board meetings, I've testified before attorneys and judges about these mask mandates, or now it's in time it will be the vaccine mandate. And no matter how much research that I might cite or studies, there are people that have studies that have, some of them have been printed and distributed and passed around on by email and various social media, and people will say, "But this doctor says this." So it is very difficult. I think the best thing that works is for individuals who have a friendship or a relationship, whether it's a family doctor or a pediatrician with their own patients, whether it's a neighbor, and trying to share that information. But publicly, having a big rally or something, or shaming people or attacking people, this happens in school boards. We're seeing school boards meetings just become, terribly dysfunctional because of the disagreements among the constituents. So that type of behavior really probably doesn't win anybody over. It's really one-on-one mentoring and coaching that I think will do the job.
Getting people vaccinated one person at a time, educating
Absolutely.
them one at a time. That's why we do what
right.
we do here every day. I want to talk about kids and vaccines. And are schools, do you think, going to start holding these vaccine clinics? What do you think that rollout's going to look like?
Yes. So they're not. It's not one size fits all, of course. For the most part, school districts, there are so many opportunities to get vaccinations, whether it's heart to heart, or whether here at KU or through the pediatrician's office, mass vaccination sites. So many school districts are encouraging their students take advantage of opportunities at the CVS or Walgreens or heart-to-heart setup or wherever you go, your own provider. However, if it seems that it would be helpful to have the school nurses administer vaccines, they'll step up to do that. That's what most school districts are looking at this point. They think they can do a better job by letting the private sector handle these vaccines at this point.
We're going to get to community questions here in just a moment. Just Dr. Beringer, what do you think this effect is going to be? You must be very happy to hear that these vaccines are available. What effect do you think that's going to have on underserved communities that this is now available?
This is how we reach the end of the pandemic, by vaccinating people. Mm-hmm. So the more people of any age that are vaccinated, the faster we get there, right? Mm-hmm. And so thankfully children have not proven to get as sick from COVID as adults, but they can still spread the virus. So as much as we can suppress the hosts where that virus sort of lives and mutates and creates a new strain and all of that, then that's going to usher the end of the pandemic. We're going to move on to I don't want to step on Dr. Hawkinson's into his lane, but probably COVID isn't going to go away. It will become something that is what we call endemic to an area, but the pandemic levels hopefully will stabilize and improve as we have more needles in arms.
All right, let's get to some community questions this morning. And the first one is from Joanne. Dr. Hawkinson, should I give my grandkids Tylenol before getting the vaccine tomorrow?
Yeah, no, there's no recommendation to pre-treat. That's for adults and children. Certainly, if they start to develop symptoms like shoulder discomfort, you can give them Tylenol or ibuprofen at that time, but really not supposed to give any medicines, Tylenol or ibuprofen or Aleve, prior to getting vaccination.
What about after?
Yeah, certainly after, if they start to develop symptoms, you can give them that symptomatic therapy.
Okay, Isaac has a question for our guests. Have your vaccine clinics had any problems as far as people skipping their second dose? What are you doing to mitigate that? How do you educate that it's important to come back for the second time?
We have had some issues with people not coming back for their second dose. We always set up a follow-up clinic when we do the first dose. And then almost invariably the numbers for the second clinic are lower. We also work, as I mentioned, very closely with populations experiencing homelessness, and so sometimes, living in a more transient manner makes it difficult. For that, we had been relying on the Johnson & Johnson one-dose vaccine, which was a great choice for certain populations. But ultimately, we do, we collect contact information on everybody we vaccinate, and we email, we call, we text, we remind them. Sometimes people forget, or something came up, and there's opportunities, if you couldn't come to the second clinic that we set up in the same location, there's going to be another clinic nearby that you will be able to access, and we're happy to have people show up to any of them.
Dr. Morsch, we always say one is better than none, but two is
Yeah,
better.
exactly.
How do you send that message home?
Well, as Augustina said, you try, you do your best. I know in some of our Native American communities, literally we'll send, because a lot of Native Americans live so dispersed, they don't live in communities, they're very isolated in their family clans and all that, and we'll actually send drivers a vehicle and go out and track them down and give them their second dose. That's very labor intensive, but that's why many of our Native American communities, Indian reservations, have been the first to reach herd immunity, even before our own country has. And we still haven't reached herd immunity yet.
But tell us again, and remind us, because I do love it when you talk about our Native American folks and just how well they have done throughout this pandemic. And they've really just, they've set the tone, and they've been such great examples of how to do it right.
Well, and again, it's trust. They trust their leaders, and that's their, and they believe in their community and respect for each other and for their leaders and their elders. And so when they're leaders, whether they're called the chief or the president or the governor or the chairman, when they are asked to come and get vaccinated or to lock down or to wear a mask, there's generally not a huge amount of argument about it. They do it. And so the Navajos, for instance, were the very first to reach the 70% mark, and they did that. Oh man, I don't know how many months ago. We were talking about it here at one of the programs, but it was many, many months ago. While the United States maybe was hitting 40%, they had hit 70% already, and they keep growing. And the pediatric vaccine availability is really going to be tremendous.
You think they'll follow suit with that?
Yes, absolutely.
Get their kids in line. So we have a question. Becca has a question. Our 7-year-old got his first vaccine over the weekend, and some family members now want to stay distant from him because they believe the vaccine sheds. Can you help us articulate why this is not true, Dr. Hawkinson? What does that mean, vaccine shedding, first of all?
Yeah, and unfortunately that was a unsubstantiated theory with no basis in truth that was perpetuated by that school down in Miami as well. Again, remember that these mRNA vaccines are just basically lipid nanoparticles, so it's basically what your cells are, and it's that way so that the payload, that mRNA, can be delivered into your cells. It can fuse with your cells. There is no active virus in here. There is nothing that is shedding. Those lipid nanoparticles are taken up by those local muscle cells, but also by the dendritic and antigen presenting cells. Then they travel to your lymph node. There's absolutely no active virus in here. Again, it's one more aspect of a misinformation campaign or just miseducation campaign. There's no active viral shedding. There's no active virus within these vaccines at all.
So Isaac's asking, any reason why you might think that the end of the KCMO's mask mandate might cause an increase in cases? And he follows that up with that some of these mandates have been out of force for a while. Mm-hmm. So, and then we haven't really seen this major increase. Do we think that this official mask mandate for all will start to see a hike in those numbers? Yeah. Anybody can jump in on that one.
We did see an increase, right? When we first started to back out of wearing masks. Initially, it was the recommendation that vaccinated people didn't need to wear masks. And then the Delta variant became prevalent, and we did see a huge increase in numbers. Now, hopefully by now we have a little bit of a better handle on it, and more people are vaccinated, so hopefully that won't be the case.
Anything else to add, doctors?
Yeah, I mean, I think, again, it's not just one thing, it's a combination of things as well. But certainly we know, most importantly, especially in those high-risk situations, a new article was out last week. I think we talked about it. There was a commentary in the science magazine Nature about that. Particularly those high-risk situations, we know that masking is so important. So those indoors, when you can't physically space, when you have a prolonged time period with other people. They also showed, though, that the masking, if just that person is wearing the mask, and especially if they are vaccinated, that will help reduce infection as well. So we know that it is a combination of these non-pharmaceutical interventions, but also vaccination that contribute to either a rise in cases or a decrease in cases. And that's why we have to do all of these things right now. But most importantly, I think, continues to be promoting vaccination.
All right, here comes the Aaron Rodgers question.
Yeah.
Everybody hunker down. Okay, so can any or all the
waiting for this one.
doctors talk about Aaron Rodgers and how he claimed to be immunized through holistic therapy? Is this possible? Dr. Hawkinson, start us off.
Yeah, this is not possible. Again, there is no homeopathic therapy that is recommended or approved for either prevention or treatment of COVID-19. There is also no homeopathic recommendation or recommended therapy to increase your antibodies. So I think the advice he was getting was completely wrong. We know that the really only way and only therapeutic, only drug to increase your antibodies is the vaccination. And it increases antibodies. It also increases those T cell responses. So the recommendations and the information he was listening to and heeding was completely false. And as we see now, this has contributed to him letting down his teammates. And we'll see what happens now after this. We've seen some other fallout from this, not in the medical realm, but certainly within his life and commercialization. So we'll see. But as far as the medical information goes, he was getting false, inaccurate information. And really the best thing would have been to get vaccinated.
Thank you for being clear about that. Doctors, when someone well-known, people look up to, if you will, puts out misinformation or says they're vaccinated but are not, or just choose not to get the vaccine for whatever reason, how much does that affect really the job you're trying to do? You're trying to get people vaccinated one at a time, and here we have someone not in your profession kind of sending people in the wrong direction. Just your thoughts about that.
It doesn't affect our work, I think. It's important to remember that in science we have a saying that says anecdotes are not data, right? We can't take recommendations, or the general public should not take recommendations based on one person's experience. Well, this worked for me, or I did the burnt orange and sugar trick and it brought my sense of smell back. Well, great. I'm glad it worked for you. But the
don't count on it.
Exactly. The basis of data is it's reproducible. It's, it happens on the broad spectrum, not for one person. So we have to trust our scientists, not our
quarterbacks.
Exactly, not our quarterbacks.
Dr. Morsch, anything to add to that?
Well, all you can do to counter. I mean, and we've seen this through, whether it's musicians or rap stars or athletes or whatever, and politicians. I mean, good grief, we've had people and members of Congress and the White House, question some of these things. So it hurts. It doesn't help at all. But I think the work that you do, Jessica and Dr. Hawkinson and Dr. Stites and KU Med here, thanks to Mr. Dolph Simons and his assistants, this is what is going to turn the tide. And I always say to my staff, let's don't be discouraged. Let's just keep beating the drum. Just keep beating the drum, and we'll get through this.
And I think another good point is when this really came out last week, when I was watching Jalen Jacoby, which is it's a radio show, but they broadcast it on ESPN2 on TV as well. He had a very good comment. Jalen Rose did a very good comment about, and this goes back to the fact that this virus and this infection is not just about you, but all of those situations that Aaron Rodgers was in, knowing he was unvaccinated, but he was unmasked around other people. What is that potential to spread it to other people who may be at more risk of severe disease than he is? And so I think that's an important thing to understand. And it's kind of a callousness and obtuseness, a lack of concern for other people.
Mm-hmm.
There is some arrogance to think that, I don't know how to call football plays. I wouldn't pretend to go and tell people how to do that. So I think there is an arrogance to people saying, well, I know all these scientists and doctors and pharmaceutical companies have been studying their whole lives to do this, but I read a blog, so I know better than them. So I would urge the public to just really vet their sources of information and just go to just trusted medical sources, and that's who you want to hear from.
Well, and I won't say it as good as Dr. Stites says, but he always says that freedoms come with responsibility. So your freedom not to mask comes with responsibility. You got to stay away from people. The freedom not to vaccinate comes with the responsibility of staying away or masking. So really well said, Barbara. Thank you for asking. She was asking how Sunny and Dominic, my kids, did after they got vaccinated here on the show on Friday. So again, thank you for asking, and they did really well. I think I was a little nervous because I didn't know what to expect. I know I had a few little slight reactions, just little fever and chills, but I sent them back to school, and I was on standby, and nope, they were great. They they weren't tired, no fevers, nothing. So Dr. Hawkinson, is it true? Because I think I asked you as well. I said, should I send them back to school? Do you think that's okay? And you said, go ahead. They're going to do fine because they've done better than adults, kids have. Is that true?
Yeah, absolutely, and especially with these lower doses that the kids have been getting, they showed when they were looking at the dose-finding studies that that dose was really a good dose for having those side effects as compared to the higher dose. So absolutely, and typically most people won't get side effects, either shoulder pain or even some of those systemic symptoms like malaise or chills for multiple hours afterwards. So I think you're safe to go ahead and send them to school.
Yeah, she didn't even flinch, Sunny, right there. So she did pretty darn good. I was proud of them. So trying to get the first of our kids vaccinated here at the health system.
Good job.
Yeah, right? Like I said, there was some bribing involved.
Well, that's all right. That's parenting.
Absolutely.
Bribing is good.
Bribing is good, 100%. Okay, Nancy wants to know, and you mentioned this, how do you get your sense of smell or taste back after having COVID 11 months ago? Don't count on these weird remedies, right? But did you have that happen?
Yes. I had COVID 11 months ago as well, and for some people, it comes back a couple of days later. For some people, a couple of weeks later. For some people, a few months later. And then I'm sure there's some people that hasn't come back yet. We only have less than 2 years worth of data, so we're still working through that. My personal experience, again, anecdote, not data, is that it took several months to get anything back, and now to this day, I can smell, I can taste, but everything is a little bit distorted. So I'm hopeful that we're going to keep moving in the right direction and get back to normal.
So do you consider yourself somewhat of a semi-long hauler with some of these symptoms lingering? How do you describe your feelings to this day?
I think people who have long haul COVID can experience such debilitating symptoms that I would hesitate to put myself in that same category, because mine is merely an inconvenience at this point.
Gotcha. Okay. So Linda wants to know, I would like to attend an indoor event and believe that there will be unvaccinated people in attendance. And that's the case because you never know who's vaccinated or not, right? She does have her booster and no underlying conditions, but people are going to be eating, so masks are going to be off. Just what are your thoughts? If I happen to get COVID, it may or may not have symptoms. Just concern about the spread of infection. Let's have that conversation because people are still wondering how much socializing they can do, and especially as the winter months come in. Thoughts?
Well, it's back to the vaccination rate. I mean, we just got to get more people vaccinated so that the likelihood of running into someone, meeting someone that is unvaccinated gets less and less. And then there is some herd immunity. People like Dr. Berenger, who's had COVID. I've had COVID. Many of us, even those of us who've been vaccinated, we can still get a variant. So I think it's going to take time. We don't talk about risk elimination. We talk about risk mitigation. So mitigation is, where do you draw the line? Do you and I try to say to patients, we're not all going to mitigate risk at the same line. Some people are going to be much more cautious, much more aggressive with their mitigation, and I think that's great. Wear your mask, social distance, maybe be careful about restaurants you go to because that's really a high-risk area when you're eating and you don't have a mask on. Others can be a little bit more laissez-faire, so I'm not sure there's any right or wrong answer. But a person needs to really feel, at least understand, there is risk in many things in life. And so how hard do you want to push this? And that's the big issue that school boards have had to deal with, and health departments, and our whole society. The CDC, where do we draw that line? Where do we say, no, this is a line we really don't want anybody to cross? the current big issue is that we'll be talking about and are talking about are the mandates for vaccinations for companies that are 100 employees or more. That's going to be another battleground, and the scientists know that's a good mitigation policy. But there's a lot of people that business owners that just say, but that's going to hurt my business. I can't go there. I don't want to go there. So
What do you think that's going to look like? A whole lot like those school board meetings? I mean, a
Oh,
lot.
yeah.
Or
I've been-
worse?
Well, school board. The school board meetings. The public, the constituents are right there. If I'm gonna be upset about this new policy of 100, I'm gonna have to go through the courts and probably end up in the Supreme Court. So I think the school board members probably have the hardest public job right now as far as facing the public. That is the front line where the battle is being fought.
Well, and
school
you
board
have
members.
very passionate and angry parents, and
Yeah.
I choose not to believe that there's any parent out there that doesn't feel like they're doing the
Right.
best for their kid.
Right.
Even if we all disagree and we're on two opposite ends of the spectrum, I feel that the same parent that doesn't want their kids to wear masks, love their kids, want what's best for their kids. The parents that want their kids masks, same feeling, right?
Right.
Of course. As Dr. Morsch mentioned, it's risk mitigation. So you take the steps that you can. We know that there's no 100% risk elimination unless every single human being just locked themselves in a in a room for the duration. Having said that, we know what to do to risk mitigate. We've been doing it since the beginning, but now we have the added protection of the vaccine. And like you said, of course, everybody wants to do what's best for their family, for their children, but also for their, the grandparents and those who are perhaps have comorbidities in their families. But ultimately, unlike things, so for example, we all wear a seatbelt when we drive, or the majority of us anyway, right? And we have a mandate to do so. You can get ticketed, you can get a fine, and yet we do it, even though that doesn't help other people, right? It just helps us be safe. So it's unfortunate that we don't extend that same slight inconvenience to protecting our society.
But we stop at red lights to protect other
We
people
do,
and ourselves,
right,
and stop
exactly.
signs, and we follow
Exactly.
rules every single day.
Exactly,
We don't
yes.
think anything of it.
Right.
So, Jonas wants to know. I read vaccine hesitancy is often community-wide. Why is that? Why do we see pockets of whole communities that are not vaccinated? Any insight?
It's a trust in the medical establishment.
Okay, back to the trust issue.
Yes, there are communities that have historically been excluded from access, and you know what? Completely valid mistrust from, in the past, medical communities.
So valid
having-
hesitancy.
Absolutely. The medical community has not always done right by every single group or population.
So they might not have the advantage of the Native American community, right, Dr. Morsch, where people are there to educate and bring them along, right?
Right. Well, and I can say for school districts are different and approach this differently, and their school boards see the mitigation strategies in very, very, in a very conservative way, where personal freedom is more important. So in rural communities, rural school districts, you'll see a lot more, I think, less vaccination rates and less trust in the vaccine and the mitigation recommendations like masks and other things. So there is quite a bit of difference. The only thing I can say is perhaps in these communities where they've allowed COVID to really, the incidence of COVID to be so high, is at least they're building herd immunity somewhat. It's not as good as a vaccine, but it's better than nothing. So, we'll get through this. But someday there'll be studies and people will really dig into this and find out. Maybe we'll learn how did masks, what was different about Pratt, Kansas versus Medicine Lodge versus Syracuse or St. Francis, and how they dealt with this. We'll learn these things. But there is a difference in rural areas, I can tell you. There's school districts that did away with the mask mandate many months ago.
And it's just unfortunate, too, because that natural infection immunity, what is the cost of that? And we understand what the cost is. That's much more morbidity and mortality, so much more illness and death than those areas and those groups that are vaccinated.
I'm going to give the last question to Kathy. And boy, that's a tough one. What if only one parent wants a child vaccinated? I mean, nobody has the answer for that, but I think I would just like, maybe Kathy would just like to hear some advice or thoughts. I mean, I bet, talk about a hurdle to try to overcome. Again, two parents, both thinking they have the best interest in one child. What would one do?
I think I would go to my trusted medical provider and try to, dig into the reasons for hesitancy on the other parent's side and understand what their fears are, because it's fear, right? We don't want our children to have something bad happen to them. So getting that information again from trusted sources, perhaps your pediatrician or your family doctor, just to address the actual specific fears instead of, I don't want the vaccine. Let's dig a little bit deeper.
Keep going. Because at the end, you have an unvaccinated kid out there.
Right. Just get
Disabled.
more information, trusted information, and a community leader or your own doctor would be a good source.
Okay. A couple more things were just about heart to heart. Just any, there was a question, and then it kind of went with a question I had, but just kind of what you consider when you're looking at bigger healthcare projects, and just kind of what the future holds with heart to heart, and what concerns you have. Because again, now you said because of COVID, you're now focusing on communities at home, but you've got communities worldwide you're trying to reach.
We are still doing that. So myself and a team of 8 volunteers, we were tasked by the WHO in May and April to go to Papua New Guinea, for example, to provide COVID surge support. So they were not equipped to deal with the COVID cases there. So we went and conducted some patient care, but mostly training, which is, the important thing that has sustainable power. We don't want to come in and put a Band-Aid on it and then have them not be able to reproduce things when we leave. So capacity building and training is how we focus on things. We look at access. If a community has ample access in other ways, then we are probably, not that it's not good to help that community, but we're probably going to go focus on another community that doesn't have as many options. And so, that certainly holds true in our Kansas City metro area, but that is also the case to every disaster that we respond, or any crisis that we respond to. If an area is hit by a hurricane, but all their hospitals and their doctor's offices and their pharmacies are up and running, they don't need us. So we like it when they don't need us, but when they need us, we're there.
And how do people find you if they want to volunteer and find out more information about how they can help?
So for both volunteering opportunities and also if you want to find a vaccine clinic near you, hearttoheart.org. We'll have all that information.
All right, Dr. Morsch, we're going to get to our final thoughts here in just a moment, but let's talk about COVID Care Force, and if a school, can schools reach out to you if they're looking for vaccine help?
Yes.
People to administer those? How do they do that?
They can go to our website, covidcareforce.org, and we've been supplying volunteers during the mass vaccination time several months ago. We really geared up for that. And now with the pediatric vaccine, we'll be doing that. But they can contact us through our website if they need volunteers.
Information right there on the screen. If they need volunteers and people want to volunteer for you, they can call and reach out that same information.
Exactly.
All right. Dr. Morsch, I'm going to stay with you. Just what are your final thoughts today? What can you send us off into the week with a good message, please?
Yeah, well, I'm here today really reflecting on school districts and our school children. And fortunately, for a lot of reasons we don't all understand, children haven't been hit as hard, infected as the incident hasn't been as high, and the outcomes. I think Dr. Hawkinson, there's maybe been about 190 or 100 deaths in the United States in pediatric patients.
I don't know the exact numbers on pediatric deaths, but it's several hundred for sure.
And when you compare that to 700,000 deaths in our country. So the pediatric population is an important one, and I think with the vaccines available now to children 5 to 11, and of course still available 12 and older through adulthood, schools are going to be back to, I think, pretty much normal soon. I mean, it may into next semester. Certainly the fall of 2022, I think, will be through this pandemic. So I want to just say thanks, school board members. Don't give up. I know you have a tough job, and but hold strong. School teachers, hang in there. This too shall pass, as the Bible says. We're going to get through this. And the work you're doing here at KU, the education, Heart to Heart, others, we'll all just stay in this and keep beating the drum.
Thank you for that. I do have a question now. You just made me think of one. Can I ask you while
Sure.
you're still here? Okay.
Yeah.
So when you say back to normal, do you mean no masks? Do you think next year our kids will be going to school with no masks?
Yeah. I actually was advising school administrators and superintendents that fall of 21 we wouldn't have to wear masks. But then Delta came along. So that put us behind. But I think, again, with the vaccine available for children now, all school-age children, and I think it'll be even younger that, give us a few months and it'll be, maybe babies will be, a newborn will get a COVID vaccine. I don't know. But I think, yes, the next school year, 22, should be, quote, normal, except that COVID is probably always going to be with us in an endemic way. So it's just one more thing we'll add to measles, mumps, rubella, diphtheria, all the other pertussis, and now we have COVID.
We call that the new normal.
That's the new
All
normal.
right, but you gave us some hope, so thank you
Yes.
very much, Dr. Morsch. Always good to have you here at the desk with us. Dr. Behringer, thank you for being here. Final thoughts.
Thank you for having me. I'm going to echo Dr. Morsch. The new normal comes when we get vaccinated in large enough numbers. In the meantime, those mutations and new strains will continue to occur. Thankfully, we haven't seen any that are vaccine resistant yet, but who knows what's to come. So we want fewer hosts for that virus to be able to do that. And my big thing is get your information from trusted medical sources, the CDC website, the FDA website, KU's website, Dogs Who Care, or COVID Care Force, or Heart to Heart, or your own doctor. There's a reason why this is a field of study. We don't all just wake up and decide, hey, let's have this worldwide conspiracy where we're all going to make something up. That is absolutely not the case. We see people die day in and day out. We want this to end just as much as everybody else, and this is the way.
Thank you both for being here today, and thank you both for your organizations and all they're doing in our community. We really appreciate it.
Thank you.
Please come back.
Thank you.
I know you will. Okay, Dr. Hawkinson, final message today.
Yeah, just kind of like to piggyback on some of those messages. Again, we know that children, luckily, have been relatively spared from this disease, but we know that there are deaths, and it also is not just about deaths. New preprint that has some commentary in the recent science update from CDC about coronavirus. We know that children can also be affected by long COVID, and they have a higher risk, a third or more chance of having that type of long COVID compared to kids who don't have COVID. Things like fatigue, shortness of breath, cough. Do you want your children at risk of having that? They should be out playing on the jungle gyms and outside, not having to deal with those long COVID symptoms. So we know that children are still affected in many ways. Death, not as much as adults, but they can be affected by long COVID. They can still get very ill. So it is very important to continue to get your children vaccinated to help stop the spread as well. Again, continued misinformation that children aren't affected and they don't have any problems. That is absolutely not true. We know that they can spread it just as much as adults. So it's very important, especially if in your bubble you have people who are at risk of severe disease. Get the people that are eligible vaccinated, get them vaccinated, keep everybody healthy, and we are and will continue to move towards normal, more like things were in 2019 as compared to 2020. And luckily, as we had talked about the variants, we haven't seen any other variant at this point that is out-competing Delta here locally, in our nation, or around the world. But we will keep looking, and we know that people are out there sequencing and identifying new variants. But right now, Delta is really the main one.
Doc Hawk, thanks so much.
Thanks.
So we have asked viewers to send in pics of their kids getting the COVID shot. And here is this brother and sister duo. These are Sarah's kids. Thanks for sharing this with us. These are her two oldest kids. They got their COVID shot over the weekend. She said, my oldest is terrified of shots, but could not have been more excited to get his. Now this one, the 5-year-old, not so excited. But she got hers and is feeling great. Nothing that a little bit of ice cream won't fix. We said bribing. That's totally okay. We're giving all parents permission to do lots of bribing. Sarah is a school nurse, so of course she believes in this layered mitigation approach. And she says that her kids really understand this, even so, more so than adults do. So again, thanks, Sarah, for helping to guide your children to that shot this weekend. And please, if you have photos of your kids, send them in. We're going to share them here on the show. And thanks for being with us today. Don't forget, if you missed the show today or any other shows, you can find us anytime on our Facebook page or our YouTube channel. Tomorrow, coming up, she is a friend of this program. You've seen her. She signs for our hearing impaired viewers, and she is hoping that her story will encourage you to get you and your kids both vaccinated. She lost both of her parents to this virus, and now her children will grow up not knowing their grandparents. But in their honor, she is taking no chances and making sure that her kids get vaccinated. So please be here to meet them, and have a wonderful Monday. We'll see you back here tomorrow at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.